1 in 3 women and 1 in 12 men over the age of 50 develop osteoporosis, a fragile bone disease. Untreated, osteoporosis may lead to disabling and painful fractures at various sites, such as the spine, the wrist and the hip. The risk of osteoporotic fractures is potentially compounded by the risk of falling. As we grow older, we are likely to fall frequently and sometimes with devastating effects. There is a dangerous link between osteoporosis and falls. A fall in a frail elderly person can lead to permanent loss of quality of life, loss of mobility and even independence. It may even result in death. All fractures are painful and debilitating, especially as our bodies, bones and minds heal considerably slower with age. Amongst all fractures, it is the hip fracture that is the most severe and life-threatening of all. The National Service Framework for Older People recommends that falls and osteoporosis are considered together if effective fracture prevention is to be achieved. Primary efforts focus on effective use of bone-building pharmacological interventions that can strengthen the weakened bones and on the falls prevention. However, despite all the efforts to prevent falling, many people continue to fall. Minimising the effects of unpreventable falls in the frail, elderly people at high risk of falling presents viable means to reduce fall-related injuries. In this programme, we focus solely on the secondary prevention of fall-related hip injuries in the frail, elderly people at the high risk of falling.
My name's Polly Mowat. I'm the second officer in Buccleuch House here, it's a residential home for the elderly. Falls found in a setting like this are a great risk and can happen at any time. You can never be prepared. Residents can be affected in various ways after a fall. It can reduce their independence quite dramatically sometimes, and it also increases the amount of assistance they need, which also has an effect on their self-esteem and their confidence and sometimes their will to live.
During our programme, we will introduce you to experts in their field and those involved in the provision of care for the frail and elderly. We'll hear of their concerns for the impact of trips and falls on self-esteem, reduced or complete lack of mobility, and on reduction of independent living.
Dr. Walsh is my name. I'm a consultant physician here in St James's Hospital. I'm seeing a lecturer in Trinity College in Dublin. I have a special interest in medicine for the elderly, and falls and osteoporosis and fracture prevention would be one of my special interests.
The effects of a fall can be devastating on an elderly person, having far-reaching consequences.
The prognosis of patients who fracture hips is not great. It's not great. But you're talking about less than half will have an independent living again. 20% are going to be dead within the year, and you're going to have 30% of them are going to be dependent of other people, are going to have dependency. So you're talking about really less than half of people are going back to fully independent living. If you're a 50-year-old white woman, your chances of dying of breast cancer and of a hip fracture are the same. Now that's quite frightening.
Dr. Bernard Walsh talking in Dublin. Let's go to a hospital in Middle England.
I'm Dr. Masood. I'm involved in the osteoporosis and falls service in this hospital. Osteoporotic hip fractures are a major public health concern. They are the cause of lots of morbidity and mortality and expenditure to the health services. It's estimated that osteoporotic fractures account for £1.7 billion in terms of cost to health and social services. Developing strategies, therefore, to prevent hip fractures is very high on the agenda. Now, we can do this through three main ways. We can try and reduce falls, and fall prevention measures are very important to consider in the development of this strategy. We can also try and strengthen the bone by giving drugs, but also the development of these hip protectors in the last 10 years has been very innovative and potentially very important. By wearing the hip protectors, we know that if an older person falls, he or she will not break their hips. The problem in the past, of course, has been the compliance of wearing these, And so the development of different models of hip protectors is very important.
The effect of falls and injuries have huge impacts on society in which we live. The cost to the public health service, the degree of aftercare, and the social impact affecting every facet of life.
I come back to hip protectors. They have a central role on the frail, elderly person with a tendency to fall. And I think if you focus on that subgroup and really focus on it, then that's compliance. And therefore all our patients on our rehab wards with a tendency to fall, all the patients in the orthopedic ward. And people say, and the important thing too, if you've broken one bone, your chances of breaking another bone, it's like a domino effect. Osteoporosis is like a domino effect. Once you begin to break bones, you really can break them. And that is the reason why if a patient has a history of breaking a hip, it's imperative that not only do you treat that hip and get them mobile again and put them on bone protection therapy like vitamin D, calcium, bisphosphonates, but you must also ensure like that their hips are protected with a hip protector, so that if they fall again, that same hip doesn't go or the other hip doesn't go.
Let's find out about a hip protector that's new in this country, even though they're the most widely used in the United States of America.
My name is Ed Goodwin. I am the president and founder of HipSavers, the first hip protector underwear company in the United States, and I want to tell you a little bit about the hip protector that we have developed. In the early 90s, the Northern Europeans had developed various types of hard shell hip protectors to cover the trochanter of an older person, so that when a person fell, the hard shell would divert the energy to one side or the other of the soft tissue. At that time, I was an engineer prior to starting HipSavers, and I didn't think that a hard shell would be an acceptable hip protector for older people. There are many types of soft pads available. These are just some sample cards of the type of soft pads that one could use in a hip protector. And I chose one based upon its characteristics for a hip protector, which would be very soft, very effective in absorbing shock, and also have a high temperature ability so that it could be washed and weared. And I took that foam and I encapsulated that foam in a waterproof nylon pouch. And what this does, it makes the garment totally wash and wear in the institutional environment. We searched for 4 years to find the ultimate material for a hip protector. This is a very soft, damping foam, and the quality of it is that it takes the energy back into the foam as opposed to the large bounce that the resilient foam gives. Additionally, this is a high temperature foam which can be washed and dried up to 250 degrees once it is encapsulated in a waterproof pouch, which is what we do at HipSavers. And this waterproof pouch that we encapsulate this foam in, making it much more durable and wash and wear, also has the secondary benefit of when an object impacts on this open cell foam, all the air is pushed out of this open cell foam and causes the pad to bloat up like this. And what that has the effect of doing is taking all of the energy and redistributing it all around the hip area and not specifically just on the hip bone, and therefore it reduces the intensity of force on the hip bone.
So, a different type of hip protector. Let's hear how it works in practice.
My name is George Gross, and I'm a physical therapist. And I worked in a program providing a full spectrum of healthcare services to a frail elderly population. The clients in this population some lived independently in the community in their own homes, some lived in elder housing, and there was also a subset of that population that lived in a dementia care unit. There is a large body of data that reports that a third of all elders over the age of 65 fall at least once a year, and that 10% of these falls result in some sort of injury, hip fractures being one of the more serious injuries with some of the more serious complications for our population. It's a very costly problem, but the cost is not entirely calculated in financial terms, that there is a cost associated with the social cost, the pain and suffering to this population.
We know that slips, trips and falls can lead to hip fractures. These are costly in so many different ways, not least in human suffering. What should be done to prevent or minimise the monetary costs and the very real pain?
As a clinical provider, we recognize the importance of primary prevention. Obviously, our principal focus is on reducing the incidence of falls. But as any provider knows, despite your best efforts, 100% effectiveness is an unattainable gain. And there also needs to be attention paid to what about the falls that you can't prevent. And in those falls, are there ways of reducing the risk to the patient of serious injury and consequences?
Much can be done to prevent falls from occurring, and fall prevention initiatives are a clear priority. But we know that despite all efforts, people continue to fall.
That's where a program of HipSavers comes in. That's where its effectiveness in reducing the risk of injury to the patients who still fall despite your best efforts at prevention.
Hip protectors are a logical fracture prevention option. However, do they really work in practice?
We began our study 5 years ago, back in 1997. We were looking at investigating the use of HipSavers to reduce the rate of injury from falls in our patient population. After approximately 6 months, we were so impressed with our preliminary findings that we decided to track the data as a quality improvement study to see what we could learn about reporting the effectiveness of this intervention. Was this something that we would want to continue and expand to other parts of our population? We were so impressed with the results that we found from this study, tracking this data, that we decided to expand the study to our entire population, offering this intervention to any of our patients who were deemed to be at high risk of falls. We studied this subject over 2 years and were so impressed with the results that we started to offer this intervention to all our high-risk patients. We were very gratified with the results of this